Welcome to the chapter on aminoglycoside dosing and drug concentration predictions, Part 1. Aminoglycosides have been in use for over 60 years and continue to be monitored in hospitals around the world, though their use has declined. The monitoring of aminoglycosides presents challenges due to the importance of dosage administration at the correct time and the necessity of collecting blood samples at appropriate times due to the often short half-life of the drug in patients with normal renal function. Dosing adjustments with the aminoglycosides can be straightforward based on measured concentrations if the dosing interval does not need to be changed. If the interval requires adjustment, the formulas used are a bit complex. In this video, we will calculate pharmacokinetic parameters based on measured concentrations after a known dosing schedule when the concentrations are measured in the same interval. I hope you enjoy the video. Alright, let's begin with patient case 1. A 50-year-old male patient who weighs 100 kilograms and whose ideal body weight is 80 kilograms has an estimated creatinine clearance of 68 milliliters per minute. He's to be given gentamicin 160 milligrams every 12 hours as 30-minute infusions. A steady-state peak concentration measured 0.5 hours after the end of a 30-minute infusion is reported as 7.2 milligrams per liter, and a trough measured 0.5 hours before the next dose is reported as 2.3 milligrams per liter. What we want to do is determine the patient's half-life and volume of distribution based on the concentrations and the dose administered. These are the measured concentrations at the appropriate times. As you can see, 7.2 a half an hour after a half an hour infusion or at hour 1, and 2.3 at hour 11.5. The equation that we're going to use is that K, the elimination rate constant, is equal to the natural log of Ci, the higher concentration, divided by C, and that's all divided by the time between the two measured concentrations. You can see here that the T change is between the two concentrations of 7.2 and 2.3. We use the formula K equals the natural log of Ci over C divided by time change. We plug in the values of 7.2 milligrams per liter and 2.3 and divide it by the time change, which was 10.5 hours. That gives us an elimination rate constant of 0.109 hours to the minus 1. Since the half-life equals 0.693 divided by K, or divided by 0.109, our half-life is approximately 6.4 hours. Now let's determine the volume of distribution. Again, you see our graph with all the points put in. You can see the peak concentration occurring a half an hour after the half-hour infusion, or at 1 hour, and the trough at hour 11.5 in the 12-hour interval of 2.3. This is the appropriate equation that describes the event. We know everything in the formula except for volume of distribution. We have a concentration, or actually we have two concentrations measured at two different times after the end of the infusion, so we can use either one of them. And what we want to do is isolate the volume of distribution to the left side of the equation and bring concentration underneath. So once we do that, we'll see again, we have two concentrations that we can use. We just have to figure out the appropriate time after the end of the infusion that those concentrations are measured. You can see here that if we use 7.2, it occurred a half an hour after the end of the half-hour infusion. So let's do the calculations. We plug in all our numbers, the dose of 160, the K, the peak of 7.2, which occurred at 0.5 hours. And then we go in and can also solve it using the trough concentration of 2.3, but in that case the time after the end of the infusion would be 11 hours. Either one of these are perfectly fine to use for the calculations. I tend to prefer using the peak because it's easier to calculate the time after the end of the infusion. Using both of those, we solve, and the volume of distribution is 28.07 liters. In part 2, we'll examine another case.